Nitin Mehrotra. Yeah, please. He will be presenting on the misdiagnosed case of orbital non-Hodgkin's lymphoma.
Good morning, everyone. I am presenting a case of a 60-year-old male patient who came with OPD with the complaints of decrease in vision both eyes and painless swelling around the eyes and the face. And patient gave history of various consultation for the swelling. There was a history of buccal mucosal biopsy, and the diagnosis was non-specific sialoretinitis, and patient was under treatment for amyloidosis. Patient also gave history of cataract surgery in left eye elsewhere and was left aphakic. On examination, the right eye was having significant cataract, nuclear sclerosis grade 3, and the left eye was aphakic with aphakic bullous keratopathy. On examination of lid and adnexia, the firm non-tender rubbery swelling, rubbery mass was palpable in both the eyes, and there is a marked narrowing of the palpebral aperture. Bilateral lacrimal gland enlargement was present, and there is also generalized enlargement of palatal glands in the salivary glands. All the laboratory tests, the general blood picture was normal, and the viral markers were normal. Montauk's negative, serum ACE and serum ANA was negative. The differential diagnosis were orbital lymphoma or Mikulicz syndrome, or it could be a case of an orbital pseudotumor. When we did the MRI orbit, there was a moderately well-defined homogeneous mass which was molding to the adjacent structure without bony involvement, and predominantly the lesion was anterior to the preseptal and the lacrimal gland. We went ahead with the orbital biopsies of both the orbits, and on histopathology, it was suggestive of large nodules of lymphoid cells which was separated by fibrous septa, suggestive of lymphoproliferative disorder. We get the IHC done, and it confirms it is a B-cell non-Hodgkin's lymphoma with a follicular lymphoma type, and the IHC shows it is CD20 positive and BCL2 positive. On the FDG PET scan, it was found it is a metabolically active soft tissue component in both the eyelids with zygomatic region, buccal region, bilateral tonsil parotids, and the mediastinal lymph nodes as well as abdominal lymph nodes, showing a widespread involvement. So the final diagnosis was a stage 3 non-Hodgkin's lymphoma follicular type, and the patient was consulted with the oncologist, and he was started on chemotherapy and immunotherapy. It is after 6 cycles of rituximab and bendamustine, and patient gave an excellent response, and presently he is on the maintenance therapy of rituximab. Post-chemotherapy PET scan shows there is no evidence of any metabolically active lesion at present. So the orbital lymphomas are mostly the non-Hodgkin's, and 80% of the orbital lymphomas are low-grade B-cell non-Hodgkin lymphoma, mostly the MALT type, but our case was a follicular type. So the take-home message is that the orbital biopsy, it helps in making definitive diagnosis, and it also provides tissue for immunohistocytochemistry, which helps in diagnosis and planning the treatment. As our case was CD20 positive, so he responded very well to the immunotherapy of rituximab. Thank you.